one egg per day saves the patient from 6 or 7 tablets. First is the egg along with white and yolk is very important and useful for both heart patients and diabetic patients, hypertensive, obese people. It has a acarbose like effect wherein it stops the carbohydrate from breaking down. Entire carbohydrate as a starch goes to the colon. There it is simplified into short chain fatty acid. These short chain fatty acids help reducing the pancreatic load. This is called as acarbose effect, equal to one tablet of acarbose. Second is the egg stops the sudden rush of blood glucose after we eat into the bloodstream, slows down like a oglyvos. So two tablets, acarbose and oglyvos, like effect is seen with by taking one egg per day. It should be a boiled egg and it should be both white and yolk yellow should be there. Third is angiotensin is one small is important substance which has a coordination with diabetes, hypertension, coronary artery disease, and cardiovascular disease. By angiotensin 2 inhibits the insulin from working, so a post-insulin receptor signaling is lost and insulin resistance goes up. First signal to know any Indian having insulin resistance is the waist circumference increases more than 85 centimeter. That itself is a sure sign that you can get a heart attack or a brain stroke or a cancer or any other diabetes and all these complications like infertility. Third is it also has a slowing down the food coming from the stomach into the intestine. These called gastrointestinal peptide. Newer drugs have come down, which are very costly, like glucagon like product, GLP, which are very costly. By taking one drug, like one egg, you are avoiding acarbose, oglibose, GIP with GLP-1 agonist drugs, and now most important angiotensin 2 inhibitor like ACE inhibitor like ramipril, telmisartan like that drug. And most important is it every egg has some peptides in it. These peptides prevent the insulin from breaking down. What is the role of insulin? It is that insulin is that the glucose enters into the cell. Only thing is, as soon as the insulin is taken out from comes out in the system, it is broken down immediately. That breakdown of the insulin is stopped by the along with the egg called as DPPO inhibitors, which are now freely available in the market. So many costly drugs are available. So for a poor patient in a poor country like India, one egg can be easily safely taken by hypertensive, diabetic, coronary artery disease, cardiovascular disease, and diabetics and obese people. Only thing is, it has a 300 calories. That is the highest mark of American Heart Association per day you can consume. More than one egg should not be taken. It should not be taken with red meat. It should not be taken with alcohol. Eggs cannot be combined with the white rice, white bread, and roti. Other than that, one boiled egg can easily be safen by every Indian. It has a lot of protein and it also has a lot of beneficial effects on the diabetics. So diabetic patients are afraid to take one egg per day safely, easily. For a country like India, it is very useful. So this message I believe very useful for you. Kindly comment, advise, and if you want any doubts also, you can ask me anytime. Thank you.